exclusive interview tonight with Missouri Governor Mike Parson regarding everything about the coronavirus. The governor put forth a social distancing order consisting, as we said, of social gatherings no more than 10 people. And he says if you live in the city or county, follow your local orders as long as they aren't less strict than the state ones.
You know, people are talking all around the state. Is our state going to have a shutdown? How can you answer that question?
Yeah, there's no plans to shut this state down at this point. You know, first of all, again, I want to make sure I'm stressed when I say that this is a day-by-day situation. Mm-hmm. But people have to take the responsibility of taking their own actions to be able to figure out how they're going to handle this. But look, if you go out there and you shut this whole state down, if you shut the businesses down, you're talking thousands of people without jobs. And all of a sudden they don't have insurance. All of a sudden they don't have the ability to buy medicine that they need normally. You know, they're at home, they don't have daycare services, their mortgage rates start building up, car payments start building up. So longevity, you got to think, how can we keep the businesses, give them much opportunity as we can to stay open? And then how do you keep people in the workforce? I mean, because that's the long-term situation we got to be in. It's going to be tough. The economy's going to tank here for a while, and that's just all you can say. So, but every day we're trying to prepare for that to make sure we're going to be ready for that downturn and how we're going to handle it. But it's going to be tough. It's going to be tough on a lot of people. So
there's no doubt in your mind right now you're not putting anyone at risk by not shutting down the state from a health standpoint.
I don't believe that's the case at all. I think people have to follow the rules, follow what we're asking them to do. And I think you're starting to see signs in other areas, other states where that's happening, and you're seeing some positive results from that. But the quicker people start doing that, the quicker we're going to be able to work our way through this virus.
When you talk about leading by fact and not fear, what should people know that means?
Yeah, I think people need to understand what the coronavirus really is and how it really affects us, how it affects you as individuals, and how it affects us as the state. Number one, I think people need to realize, they understand that if you have the coronavirus, it's not that you're going to necessarily be in the hospital and you're going to be quarantined in a hospital. Mm-hmm. You understand that probably well over 90% of the people walk out of that and they go home and they're quarantined. Right now there's 14, I think, out of the 114 counties in the state of Missouri that has it. You know, on the good news side of it, there's 100 counties that don't. But I also realize that these numbers are going to grow daily. So I think people need to understand, much like any other virus, it's going to spread. But it's how we react to that, and how do we know the facts from all the hype about, the fear tactics and some of the things people are so worried about, to make sure they understand we're going to be okay.
Governor, I've been asked if I have heard of a mandatory federal government shutdown of 2 weeks coming up that the National Guard is mobilizing right now. Have you heard anything of this nature, or do you expect anything like that?
Well, I don't. I think right now the conversation we're having with the White House for all of us and with most of the governors is allowing all of us governors to utilize our Guard in a much more greater capacity to where they fall under our control, not so much the federal government as far as they do the state controls. And that's to use for transportation situations. That could be for taking medicine, specimens, delivering specimens down, setting up temporary sites for mobile testing. But we're not in the position yet where we're going to do like martial law, or we're going to bring in the Guard or the services. I don't believe that's even being talked about on the federal level or the state levels.
Are you making decisions based on facts that you're seeing with numbers?
Exactly. Every day the numbers change. Every day things change where you have to make a different game plan almost every day. But I've got to be able to look at the state as today and tomorrow, but I also got to look at it 6 months from now. I got to look at it down the road to see how this is going to affect us on the economy, how it's going to affect people that's going to be out of work. What are we going to do for unemployment? What are we going to do for daycare? I mean, just a number of things that are coming up every day that we're trying to find solutions to, and really are being prepared for that. At the same time, this is going on, and why sometimes in the position of a governor, you got to understand you have to be able to multitask things, because the big thing is we got flooding now that's starting in northern Missouri, and thank goodness we've been prepared for that several months, knowing that was a probability of coming. But all of these things together and still be able to run government is essential. You do that as a leader, and that's what we're doing right now, to make sure we're getting people the facts, to get them the information, and really how to protect themselves. Because at the end of the day, people's got to take the responsibility upon themselves to abide by the orders, to do what they're being asked to do by leaders across the state. That's just essential to make sure that we can control this virus as much as we can control it. But they have to follow the orders that we're asking them to do.
You're talking to doctors. Is there a reason for people to have fear of what's going on?
Yeah, one of the things we do, we've got a great medical profession here in the state of Missouri with great facilities, and these people are working around the clock. When you get to see what I get to see of all the amazing things that are done through the medical institutions, through the private sector working together to come up with solutions for this, it is totally amazing what they're doing. But we got some of the best here in Missouri. We're lucky. We got WashU up here. You got the University of Missouri that's now engaged. Hospitals are now getting more implemented into how to handle the situation through mobile testing, things like that. Every day they're changing, and we're trying to provide those services to people. And those are the good news. That's the good things that are happening. And I'm optimistic to think that we're going to get better and better at that, of trying to figure out what we can do with this disease, with this virus, and how we're going to be handling it. And I do believe in the near future there will probably be medicine we're going to be able to utilize for that.